My name is Aviram Nissan. I'm a professor of surgery and the chief of the Department of General and Oncological Surgery at the Sheeba Medical Center near Tel Aviv. My general surgery training was at the Hadassah Hospital in Israel, and my surg-onc training was at Memorial Sloan Kettering in New York. Since then, I've been doing complex GI surgery, colorectal or gastric cancer, primary and metastatic, liver metastases, pancreatic, and above all, tumor spread to the abdomen, to the peritoneal lining, the inner surface of the abdomen. I have a broad referral of patients coming from various parts of our country of Israel and worldwide. My team and myself, we went to establish surgical oncology and peritoneal surface malignancy centers in numerous countries around the world, including Ukraine, Russia, Serbia, and Kazakhstan. We were consulting on centers in the US. My first acquaintance with cold plasma was through a dear friend of mine, the late Dr. Barry Trink. He was a biologist working out of Johns Hopkins. Later on, he did a sabbatical in my lab, and then when he returned to the US, he introduced me to Dr. Canady and the concept of cold plasma. Plasma is the fourth state of the matter, ionized gas. When most of the generators used for medical purposes are producing hot or very hot plasma, cold plasma, in a way, it's a way of energy to dissect human tissues, and more than that, ablate cancer tumors and various cancer deposits all over the human body. Our main experience with the cold plasma and Dr. Canady's research group from the US was in a phase 1 trial. This trial was conducted in 2 centers, Sheeba Medical Center and Rush University in Chicago, and we enrolled 20 patients, all patients with metastatic cancers. All of them underwent complex surgery, and using the cold plasma blade from Dr. Canady's group, we were able to show that first, it is entirely safe, no side effects, no damage to normal tissues. About 60% of the patients are still alive, which in this type of diseases is quite remarkable. We don't know yet, we don't have the final results. We are summarizing now the data, but it looks very, very promising. Jeremy is a success story. It is success not only of one surgeon or one hero, it's a teamwork. And the great advantage that we were able to look not only at the tumor that Jeremy had, but also on Jeremy as a whole, as a human being, as a patient. We were able to master the diabetes and other problems that he had in a way that we brought him to surgery in the optimal manner. And that was a huge team of doctors from multiple disciplines. We used the cold plasma during surgery, and right now Jeremy is out of surgery almost 3 years now without any signs of recurrence, and this is really, really one hell of a great success story. The Sheeba team, all together, all the great people of Sheeba, together with the Canady Research Group, were able to achieve the unachievable. On top of the 4 traditional arms, which are the surgery, chemotherapy, biological agents, and radiation therapy, I do believe that cold plasma, as a representative of physics-based technologies, will join or even replace some of these traditional modalities of cancer care. Using cold plasma is as simple as using the most electrocautery tools that we have in the operating room. It takes 3 or 4 minutes out of a 10-12 hours operation. It's easy to use, very intuitive. It's like taking a pen and writing a sentence, or not more than that. It's just something you do intuitively. Me and my team and the entire Sheeba Medical Center are very, very proud to head the first FDA phase 1 trial in human subjects using cold plasma. Following our success with the phase 1 trial, now we are moving forward, and in summer of 2022 we will launch a phase 2 trial in multiple solid tumors. So we will be able to enroll patients with various cancers in order to try the cold plasma and its efficacy and establish the threshold or the benchmark for future clinical trials.